When I formulated a binder for my patients, it was crucial to me that I focused on the ingredients that had the best scientific support. And so after my research, I was shocked to learn that the most common binders on the market are actually loaded with ingredients with poor efficacy. So this is a chart that shows how well various binders are able to attach to mycotoxins in vitro. And so to orient you here, we see the binders on the column on the left, right? These are a variety of binders from AC being activated charcoal to bentonite clays to yeast cell wall to zeolite clay. And then you see the mycotoxins, named mycotoxins across the column row here to the top. And what I want you to focus in on is that they're not all created equal. Look at the efficacy of activated charcoal, right? We get an 81% average binding to mycotoxins, which is pretty fantastic. It leads the way, and that's due to its specific chemical structure. But compare that to zeolite, right? Zeolite, we are really only getting 32%. It's just not the same. And so I think this matters because we really want to be focusing on the products and the treatments that have the best scientific understanding and rationale behind them. So I first want to show you examples of poorly thought out binders, and stay to the end because then I want to show you what I feel like a binder should be and why it's important to use high quality, the most effective ingredients. So here are two very popular binders that are available on the market, sold everywhere. And you'll see GI Detox leads with zeolite clay, right? And we just saw that that's the most poorly performing binders of those binders studied. And what you should know is whenever you see a blend on a supplement, that should be a red flag because this means that the company does not need to tell you how much zeolite clay is in it, how much charcoal. They only need to guarantee, if someone checks, that zeolite clay is made up in the highest percentage and the ingredient listed last is the least. So we are leading with the worst ingredient here on the GI Detox product. And then here's another one. So I generally like the formulas from Research Nutritional. So I was disappointed to see things here that just aren't supported by the clinical literature. So you see zeolite. And again, this video is on zeolite because I think that's the most common binder that I see patients coming in and having failed or reacted to. But there are other things here that are not studied. Humic and fulvic acid, pectins really don't work well. Same thing with silica. So I really am disappointed that some of these products are kind of full of things that don't work particularly well. It's a little disappointing. Okay, so this is what I formulated. This is called ProBind Select, and I formulated this in concert with Dr. Jeff Moss at Moss Nutrition. I worked with them for quite a while, and it was really important that I include the ingredients that were the best proven. So you see here equal amounts of clay, charcoal, and chlorella, and then you also see the probiotic species whose cell walls are uniquely structured to grab onto toxins. Now, not just mold, but heavy metals, plastics, endotoxins, carcinogens. These are really powerhouses when we're trying to detoxify. And so the research really brings this out, and I really wanted to include that. And then the last thing I'll just focus in on is, again, it was so important that I have transparency with the things I'm giving patients. When I'm giving a capsule, I want to know exactly how much of each material is in it, because the truth is that detoxification can be hard. Some patients are very, very sensitive to binders, and if you don't go low and slow, you can get in trouble. And so I wanted a product that I could start someone on a quarter dose by giving one capsule and then slowly working them up to 4 capsules of the binders that are best studied. And so you don't see any zeolite, you don't see any silica or fulvic acid. I'm very proud of this product. And the last thing I'll say is, even though I'm proud of it, this is not a sales pitch. We made the decision this is only available for practitioners through Moss Nutrition, because again, detoxification is hard, and patients deserve to be treated by experts who are well trained. And I don't think detoxification is something that people should go it alone. Okay. Lastly, let's end on examples of why it's really important to focus on high quality ingredients and not be putting in junk fillers, right? This is a patient on the left. You see mycotoxin results. This is from the real-time laboratory. And although I don't think urinary mycotoxin tests are the end-all be-all, it is nice when we see drops in the urinary mycotoxins that correlate to clinical progress, and in this case, correlate with a year of high-quality binders. You see all the named mycotoxins trending downward nicely, and this patient did absolutely fantastic. The other thing here, this is not a video about heavy metals, but I thought I would sneak in an example because binders don't just bind mold toxins, they bind lots of things. And so here is an example of a separate patient who was treated with high quality binders. And you can see the blood lead level starting at a scary 6.2, dropping to 2.8, and then again to 2.1. And this is consistent with what I generally see, that being a 50% drop in heavy metal levels about every 3 months that someone is on a binder on a daily basis. And so I hope that this video really helps us begin to focus on ingredients in functional medicine that are the best studied. We really don't want to be taking supplements that are, formulated by vibes or just ingredients that sound cool, which I can't help but think that patients expect zeolite or they expect silica, they expect a whole bunch of odd sounding ingredients, and maybe they sell better. But I think as practitioners and those of us really dedicated to research and results, we want to just aim for the best studied binders, the best studied products we can give our patients, because our patients really deserve standard, excellent quality supplements so that they can get better and we can trust that they get better. So hope this helps you heal your patients. Take care.